We're gonna get.
Hello and good evening. We appreciate you joining us tonight. My name is Alyssa Scarciotti. I'm with Lexier Dental Laboratory Group. I'm our client education specialist here at the lab. We are presenting on Smart Denture Conversions. So I do just want to mention, unfortunately, Dr. Copert had a last minute conflict and he will not be able to attend, but he has certainly left us in good hands. So we have Dr. John Bender. He's a prosthodontist out of New Jersey who has a lot of just clinical experience with the Smart Denture Conversion system, and then also has an excellent research study that he's going to be sharing with us. And then we also have Ryan Napolitano. He's here with our lab. He's our director of implants and surgical products. So it's great that we have, Dr. Bender, who can talk about, clinical experience. And then we have Ryan, who's going to, just kind of round that out with what we see at the lab. Just a couple little housekeeping items. If you have any questions, please feel free to enter them in the chat. We'll do our best to either address them during the presentation, but certainly we will make sure to get to any questions at the end. And you are all going to earn 1 CE credit for this program, and CE is provided through Smart Denture Conversion. So usually just takes like, a couple weeks to get those out to everyone. You can go to the next slide. And then a little bit, just briefly, this is just a little bit about our lab group. We are a multi-location lab group. So we have locations spanning from up to Rhode Island, Connecticut, Maryland, Florida. Then we have our cosmetic lab in Florida, and then we have Blue Box in Mississippi. As you all know, especially with the digital world, we certainly service people, clinicians throughout the country. So that is a little bit about where our footprint is. We certainly are, able to service any of the offices throughout the country, throughout these multiple locations at the lab. I see we already have a hand raised. Let me just see. Oh, maybe everyone's just saying hi. All right. Well, if you do have questions, please feel free to enter them in the chat. And without further ado, I'll hand it over to Dr. Bender.
Okay, Alyssa, thank you very much. And I just want to echo what she said. If anyone has any questions, please speak up, put in the chat. We're more than happy to answer everything. And I think you're going to be very excited with what you see today. So I want to start out by saying thank you to Lexier Dental Lab Group, and thank you Smart Denture Conversions for inviting me to lecture on Smart Denture Conversion. I'm a prosthodontist from New Jersey. I practice full mouth reconstruction, and especially on implants with the All-on-X. It's a fantastic treatment, and I've personally changed many lives and seen a lot of my colleagues change a lot of people's lives. So anything that anyone needs or any help, questions, please speak up, because we're really changing lives out here with this treatment modality. So what we're talking about here today, just to briefly summarize, is we have a patient who has a full arch of dental implants, and whether they're placed that exact same day or whether they're integrated, if as a dentist or as a lab technician, you have a complete denture. And what the denture conversion is, you take a removable complete denture, and within a couple hours, you convert the removable denture into a screw-retained interim prosthetic that is screwed in. The patient cannot remove it, and it acts as a temporary until you can get to your final full arch prosthetic. Now, denture conversions have been around for decades. 1985, Dr. Thomas Balshi was one of the first to publish on converting a removable denture to a fixed interim prosthetic. And luckily, we have Dr. Coford, who is also prosthodontist board certified and practices on these full mouth reconstruction, All-on-X cases. And he took the denture conversion and revamped it, and he coined it Smart Denture Conversion. Now, the difference between, and this slide is very important, the difference between the conventional denture conversion using the long temporary cylinders and Smart Denture Conversion nowadays, the revamped version, is Smart Denture Conversion is much faster. than doing a conversion the conventional way. You can do a smart denture conversion in as little as 30 minutes. Versus when if you're doing a conventional conversion with the traditional temporary cylinders, the old school way, that easily takes a few hours. Secondly, if you convert your dentures with smart denture conversion, the prosthetic is stronger. And it's stronger because smart denture conversion, as you'll see, will have smaller screw channels in the prosthetic. And lastly, it's a much better outcome. And I say better because you have better occlusion where you're actually picking the denture up in occlusion. So there's virtually no occlusal adjustments after the pickup. And you can really idealize your convex contours and in the intaglio because you're not worried about making a converted prosthesis bulky intentionally or shelf-like intentionally for strength, since smart denture conversion is stronger. And I'll show you everything. I'll show you cases. I have a research study as well, and I'll go in exactly how smart denture conversion is faster, stronger, and better. Every single person I talk to, whether they're a lab technician working with dentists or whether they're dentists or specialists, oral surgeons, prosthodontists, periodontists, they tell me, John, once I did smart denture conversion, it's a no-brainer. I'm never going back to the old traditional way. Smart denture conversion is simple. Dr. Coford, I'll be saying this a lot. Dr. Coford made the conversion technique to fixed as simple and exactly the same as you would do a locator pickup for an overdenture. It's very predictable. Uh, a lot of the times when you're doing a traditional conversion, you pick up the two anteriors and then you save the two posteriors for after, or you pick up or you try to pick everything up and you can't get everything in one shot. With smart denture conversion, you pick up all of your tie bases, all of your temporary cylinders in one shot almost every single time. It's faster and stronger. So I'm going to say this a lot because this makes the most sense. In this picture, these are locator housings. And the best way to describe smart denture conversion is you are doing a fixed conversion, a fixed denture conversion, exactly like an overdenture conversion. We learn overdentures in pre-doctoral dental school. Like there are dental students who don't even have their license and they're doing overdenture pickups. It's very simple. You have the implants in the picture. You have a locator housing. This is for a removable overdenture, not for fixed. You have a locator housing. You click the locator housing on to the implant. You block out the undercuts, syringe your pickup material around, put the denture on, let everything set, take it off, and boom, everything's picked up, and you have your overdenture. Very simple. Now, how did Dr. Coford make a fixed? Now, the difference between an overdenture and a fixed screw retained prosthetic is an overdenture you click on and click off. A fixed denture conversion, you're screwing it into the implant. You're screwing it into the multi-units with tie bases on top of them. So how do you go from an overdenture with no holes in it and it's removable to a fixed denture conversion using the same technique? Well, Dr. Coford and Smart Denture Conversions, they invented a screw that intentionally separates. It's called the separatable fastener. It has a titanium screw thread and a peak head. And the peak head and the screw are together, but when you click the denture off, exactly how you would click the denture off for an overdenture pickup, the screw head comes out. And that's the secret, that's the magic, how smart denture conversion is as simple as a overdenture pickup instead of a conventional conversion where if you take a denture and lock it over, it's locked in. You would never do that because you need to have screw channels. The basic procedure is, as I was kind of saying, you have your denture, upper or lower denture. You're going to place your acrylic into the wells, exactly how you make wells for an overdenture, but you make the through and through access channels for a fixed denture conversion. For smart denture conversion, you're now in the realm of simplicity of overdenture. So you're just making some wells to fit over the short tie bases. We'll get into that with more pictures. Since there's no screw channels and no long cylinders, the patient is closing right onto your denture, exactly like an overdenture. So the pickup is done in occlusion. And from there, once you have your pickup and you're at the same point where you would finish your overdenture, then you just flip it over, trim off all the flanges, and you make it a fixed screw retained prosthesis. So this is a video actually right here of picking up a lower in occlusion. So we've got the implants placed, multi-units on the bottom, short tie bases only with smart denture conversion with the screw that separates. So right now, this is exactly how you would do an overdenture pickup. Exactly how the dental students in every dental school are doing overdenture pickups. Really easy. Let me play it again. And notice when Dr. Kofer did this pickup, he just took some bite registration and luted the lower denture right into occlusion, right into occlusion. So he injects the autopolymerizing acrylic and has the patient just close into the predetermined vertical with the removable dentures, close and hold, let that set. Now, if you see the video to your left, exactly like an overdenture, you now let it set and you click it out. Right there, how he just clicked it out. Now, when you click it out, if you look at the right illustration, you're seeing that peak head separate from the screw. So if you did this with the traditional denture conversion technique with the long cylinders, you're not taking that out. But because of this patented separable screw, smart denture conversion is being removed from the multi-unit. So now you have your denture with all of your tie bases in it, but no screw channel yet. And this is just a tool where you remove, see how this the separable fastener on the right side of the screen, you have the screws and they separate. You just take those out with this simple tool. You can actually do it with your hand or with a cotton plier, or you can use this tool. Now the multi-unit is free. And this is an illustration showing how the screw separated, that's the multi-unit in the mouth, screw separated, and you just back it out. Now this multi-unit is ready for a denture conversion, a fixed interim denture, screw retained, to be screwed into it. And I highlight this because this is very important. You have to take that screw stem out. Now, what we have, I'm going to play the video, is now you have a denture with your high bases or your short temporary cylinders inside. It's ready to go. It'll click onto the multi-units, but there's no screw channel yet. Well, exactly how a race car driver team, how the race car comes in and the whole team comes out and they screw in this new tires, new gasoline. Smart Denture Conversion has three very simple drills, which you're about to see, to make perfectly small screw channels, exact 2 millimeters wide, exactly what you need for a prosthetic screw. And you now turn it from an overdenture to a fixed interim hybrid screw retained full arch with just three easy drills. And you'll see right now, I'm going to press play. This is the first drill. It's called the pilot drill. So that's your tie base. And there's no screw channels. If you looked at the denture, it's untouched. Now you go through the other end with a second drill, and there's your screw channel. It's very simple. You go right from the underside, because if you see the denture, and then this is the last drill, it's three drills. The last drill is just removing any excess, any debris. And you do that for all the implants. So if you have four, and boom, you can see in the end of the video, you can see now it's a through and through channel. So you took it from an overdenture, simple as heck, and now dental students are doing it. And now you have a screw channel where you put a prosthetic screw in and it goes right onto your multi-unit abutments. And if anyone is done, and I'm sure everyone in the lecture has, if you did this with a regular traditional conversion, you don't have these small, beautiful access channels that preserve structure. You have massive holes in the denture. You have massive holes because you have the long temporary cylinder. And if you're not following or sort of following, Ryan's coming after me. I got a case and I got lots of pictures, lots of videos to show you. Another great thing is with the separable fasteners, you can accommodate for up to 70-degree angulations. So you can have one implant here, one implant here, one implant here, one implant here. Sometimes when you're doing the old school conversion, you got to put on 30 degrees, 17 degree, take it off, put it back on because you want everything perfectly straight because you got to have good parallelism. Well, you don't have to worry about that too much with Smart Denture because you're up to 70 degrees of divergence because the components are short and you have the separable fastener. So here is another illustration of how Smart Denture works and how this all-on-X temporary hybrid works. The goal is, and what everyone's doing nowadays is you have a patient, hopeless dentition or no teeth, you put in the implants, at least 4, and you put the multi-units on. Okay, that's the upper left. So the surgeon went in, took out the teeth, put in the implants, put the multi-units on. Boom. Then on the lower picture, you have a denture. You have a denture. We're going to connect the denture and screw it into these multi-units at the end of the appointment. Denture conversion. We're just making it easier, more predictable, faster. Let me go back here for a second. So upper left picture is surgery with multi-units. Then if you look to the right, everything's sutured up now, and you see how they put the short tie bases on, not the long temporary cylinders, but the short tie bases, and you see the little white screw on the top of the tie base? That's the separable screw, the separable fastener. You're only going to find that with Smart Denture Conversion Kit. So you got the short tie base and the separable fastener. Okay. Then you take the denture, you fill it with acrylic, you pop it on, you wait a minute or two until the acrylic sets, pop it off, and it picks up all the tie bases, and you have the multi-units. Now, once you take the denture off and you got it made, you have everything there. Now you got to take the little screws out. Because if you finish the conversion, because it's so easy and simple, and you leave the bottom of the screw in, you're not going to be able to put the prosthesis back on. That's what we keep saying it. You got to make sure you follow all the steps. This is the tie base picked up into the denture, and you see that the peak head is inside. So that's what the drilling sequence is. When you do the drilling sequence, you're going to blast away the peak head and make a nice access channel for a prosthetic screw. So notice here, you don't have any holes in your denture. You already did the pickup. Underneath this denture is all of your tie bases that go right on top of your multi-units. But because it's Smart Denture Conversion, you're not blowing open the denture and trying to let these long temper cylinders in. This is why you can do the pickup in occlusion. And now you go from what looks like an overdenture, and just with those 3 drills, you go from the bottom up with the pilot drill, then you go with the second drill. This is the pilot drill. Then there's a second drill that follows your pilot. And then this is the removal tool at the end. You get the debris out, and sometimes that peak head comes out at the end. And now you can see the before looks like an overdenture. You can't screw it into any multi-units. And after, you have the screw channels. Perfect. And this is why we say it's once you do Smart Denture Conversion for your conversions, you're never going to go back to the old way because look how pristine and small those screw channels are. Don't you think that prosthetic is stronger than doing it the old way when you have to drill it all up? Don't you think that prosthesis is prettier than doing it the old way? Aren't you going to feel good when you picked up an occlusion? So after you trim and polish it, you screw it in, the patient bites, and the bite is perfect, or like 2 minutes of adjustment. And then you can make the intaglios all nice. You know, we follow flat or convex for hygiene. And the difference is now between fixed interim hybrid and overdenture, you cut away all the flanges. You cut the flange away, so it's a nice streamline implant prosthesis. And here we go. The left picture looks like a final, but it's not a final. It's just a denture converted with Smart Denture Conversion. You just had a regular denture, whatever you want to print it, you want to mill it, you want to have the lab make it, you want to process it yourself. You had 4 implants put in. You were smart and you got smart denture conversion. You put the tie bases in, you screwed in the separable fastener screwed, you picked it up like an overdenture. So simple. And then you just make the screw channels and you screw it in. Really. Smart denture conversion users, I'm one of them, Ryan's one of them, a lot of my friends are them, a lot of my colleagues are them. When I'm on social, I was just telling Ryan and Alyssa, when I'm on social media, now I'm seeing everyone using this because it's a no-brainer. You're going to have better results, cleaner, nicer occlusion, faster, much less stress, faster procedure, faster treatment, more predictable, less stress, happier doctor, happier surgeon. You'll get more referrals. The patients will refer more to you because you made it look easy. This is so hard doing it the old way. Okay, so this is me. I am prosthetist working in New Jersey. I do all pros, but I love full arch implants. And here, I should have started with this slide. Here is top is one of my favorite pictures ever. If you're kind of like lost for a second, or you're like, "Oh, I get what you're saying, it's better, but how is it better than the old way?" Or you haven't done the old way in a while. Top is the old way. You got to take a denture, you got to drill big holes in it. This guy is actually pretty good at drilling the holes because when I do it, they are much bigger. Sometimes you break the denture when you drill the holes into it, then you have a problem. And you have to have the cylinders stick through so you can, get to them and retrieve them, and then you got to finish and polish it. And no matter how good you are, it just doesn't look that great because you had to mutilate the denture to get the job done. And this is not picked up in occlusion. The top is not picked up in occlusion. The bottom is smart denture conversion. You don't drill holes in the denture beforehand and weaken it and break it and drive yourself nuts. Then after you do the pickup, and you can't even see the tie base because they're so short, you just make the screw channels. Okay. I like to grab people's attention because I've been in a lot of lectures myself. Let's do a case. Let's do a case. So this patient, non-restorative maxillary dentition, she wants fixed teeth. Okay. High smile line, right? So you always make sure that you have them really, really smiling, because lips repose, so the teeth drifted down. You can see huge caries, infections. All these teeth have infections and really bad wear. We kept her lower dentition. If you're wondering, oh, I could save these teeth. Well, we kept her lower teeth. We just gave her a couple implants in the bottom. But you see how all these teeth are bombed out, but she has nice bone. So I do the surgeries and the conversion myself. So here's my treatment plan of the teeth. That'd be nicer when she smiles if the teeth were in that position. Then we had a denture made. You can have a regular denture with the palate. There's no problem with that, but I've just been doing it so much, I just want a little bit less cleanup, so I just have a horseshoe denture. Here's the implants plan, just an all-on-4, just an all-on-4. A teeth extracted, alveoplasty, okay? Implants are going in. Implants are in. Let's now, and the multi-ins are on. Let's whip out our Smart Denture Conversion Premium Starter Kit. This is what you get. You get the short tie base on the bottom, the screw with the peak head that separates only within Smart Denture Conversion. No other company has that. No one thought about it. No one thought about making a fixed denture like an overdenture until Dr. Kofer thought of it. The upper driver is very important. You got to use the white driver head with the peak white, okay? Because you can't overturn it. So there's some rules with this system, but if you follow the rules and get it, your life is easy. Your life is 10 times easier. Here's the screws with the peak head inside the little short tie bases. I sutured everything shut. I put the multi-units on, and now I'm just screwing on the tie bases with the driver. Here it is, okay? Closed up, implants in, multi-units on, smart denture, tie bases on, smart denture screws in. Then you got to block out all these sutures with a rubber dam. I didn't touch the denture. The denture is untouched. So you just put it in occlusion, make sure that it's all bored out on the inside so it'll fit over these tie bases. In occlusion. So spoiler alert, when I finished this, I screwed it in and there was no occlusal adjustment because you picked it up in occlusion. You can't do that with the old way, with the old school way. There's nothing wrong with the old school way. I've done it many, many times. But we have newer ways of doing things now in modern times. Filled the whole denture with pickup acrylic, put it over the tie bases, blocked out all the sutures with the rubber dam. Boom. It's set. It's set. I just take a back of a cotton plier and I click it off. Exactly how when you have an overdenture, you let it set, patient close, wait a few minutes, pop it out. Exactly how you pop it out like an overdenture removable, you're gonna pop it out for fixed hybrid too. And you pop it out, and I got a wooden desk here, but I don't even really need to knock. Every single time I've done smart denture conversion, I always pick up all the tie bases. I always pick up all the tie bases. So it's great. It's really predictable. You really 4, 6, 7, 8 implants. You're not wasting any time. That's why we say it's faster because you line it all up, you slap on the denture, and it picks up all the tie bases at once. And now you see how the screw separated? That's why you can remove it. You can remove it because the screw separated. You can't do that with the old school technique with the long temporary cylinder and the regular metal screw. You put the denture on, you're not getting that off. So don't blame me. You gotta be using smart denture if you want to make it simple and easy like this. Now, overdenture, overdenture. I'm gonna keep saying it. Looks like an overdenture. There's no screw channels. You can't screw this into implants for an all-on 4 until you flip it over. You're gonna clean up the excess, and I flip it over, and I take the Smart Dentures drills, and I just go through real quick, like boom, in and out, boom, in and out, in and out, in and out. Takes 15 seconds. Takes 15 seconds. I do see people raising their hands. So if there's a question that we see, or if you want me to go back afterwards, we'll go back afterwards. But maybe I continue and answer his
Yeah,
question.
if there are any questions, just enter them in the chat. Just because of the webinar format,
Yeah.
everyone is muted. So the
Mhm.
best way, if you have a question, or maybe these are just high fives,
Yeah, yeah.
just
And
enter them in the chat. We'll be happy to answer them.
and then if for some reason chat's not working, then we'll unmute people at the end, if that's
Yep,
possible.
it is.
Okay. So then, as I said, looks like an overdenture, same process as an overdenture. Now I went in and out 4 times, took 20 seconds. There's my pilot hole. Now, here's something that happened here. When I set the denture teeth or when I chose the multi-unit, I didn't see how number 10 is a bit lingualized. It's lingualized. Really, if you were setting teeth proper, you would have kicked out 10, you would have kicked out 11, kicked out 12 and 13. So because of that tooth setup that I did and the multi-unit position that I did, actually the screw channel is coming out the facial of number 10. If I chose to do conventional or regular or old school conversion at this point in time for this patient, this case is 10 out of 10 hard, messed up now. Because just like I showed you the picture of the old school and smart denture with the big holes in the old school, you would have blown out 9, 10, and 11. You would have blown those teeth right out. But because we're doing smart denture conversion, everything is easier and it's much more forgiving. So notice how I got a screw channel coming out the facial, but look how that turns out. Then you go from the top with drill number 2, in and out. Okay, now it gets wider to like a prosthetic screw, but you can kind of see the little white halo on the inside. That's the peak screw head. That's the peak screw head. So we got to use the last drill, the third drill. There's there's the buckle now. You can see number 10, but that's still very controlled right there. It's not a problem. Uh, then I went in with the last drill and I cleaned out the bulk. So you can put a screw and screw it all the way down. Then you can put your replicas on, your multi-unit replicas, and you can, you know, polish and smooth and contour, et cetera, et cetera, et cetera. Backfill, no voids, et cetera. And that is the finished product. Okay. And that's screwed in. And if you look real close, I just took composite and I just flowed composite Teflon tape, screwed it in, Teflon tape, and I put composite right over that number 10. And no one, you don't see it. You can barely even see it. So that's another hidden gem of the Smart Denture, is that it is very forgiving with those screw channels. And there you
Dr.
go.
Pender, just to briefly interrupt, we did have someone type something in the Q&A. So the question was, what type of implant multi-abutments are these compatible with? And Ryan had just answered. I just want to make sure everyone saw it. Currently, Smart Dentures is compatible with most major systems and their clones. So Zimmer, 3i, Straumann, Nobel, and others.
Yes. Yes. So not every single multi-unit, because that's impossible because there's hundreds of implant companies, but the big major players are
Yeah.
covered with Smart Denture Conversion. And the longer this is out, the more it's going to cover it. And so I'm sure whatever multi-unit you're using, call us at Smart Denture Conversion, double check that we support it. I'm sure we support it. And a little sneak peek, and all I'll say is there's even a multi-unit, a game-changing multi-unit coming out. So you might not even have to worry about multi-unit not being supported if that's like a 1% chance there. But yeah, I mean, this was Astra. So you named all the big players, Alyssa, and I, in this case, I used Astra, so it even is good with Astra as well. Or maybe I used a multi-unit that goes into Astra that Smart Denture works for. But as I said, I see so many clinicians and lab technicians using Smart Denture. Don't even worry about it. You're gonna have a multi-unit that's
Yeah.
covered.
And then if somebody's using a system that is not supported, you can always use a multi-unit abutment from a company like Preet or Des, and those companies have full compatibility from their multi-unit platform to Smart Dentures as well.
Exactly. Exactly. So don't be like, oh man, my multi-unit isn't compatible with Smart Denture. I'm just gonna do the old school way. Contact us. We will get you the multi-unit that's gonna work. Okay. Yeah, yeah. And then with AP spread, things like that, we wound up adding some pterygoid implants. I put in some pterygoids later on, and we gave her up to second molars. And I did Smart Denture Conversion with the pterygoid implants too. That was at a later date. Okay, now I have my research. I did my master's research very quickly. I did my master's research when I had to graduate a lab study on smart denture conversion. And I wanted to find out, is smart denture conversion with these little tiny screw access channels, is it really stronger than doing it the old school way where you mutilate the denture, bomb through it to, house those temporary cylinders? Well, I took PMMA dentures, milled dentures, 3D printed dentures, and I want to know, even though I'm a big fan of smart denture conversion, is smart denture conversion really a prosthesis? Is it really stronger than a traditional denture conversion technique? And you want something strong, because if this interim denture breaks while these implants are osseointegrating in those 3 to 4 months, you have a problem. You have micro movement of those implants, and that can lead to implant failure. So another reason to choose smart denture conversion: easier, faster, simple, stronger. You're about to find out and see that it is stronger. And then does any material choice influence fracture strength? So I took all these mini blocks, like, pretend this is a full arch, same size, same height, milled. See the long temporary cylinder? See how the picture has the big access channels drilled out? And see how on this one, this is a smart denture conversion. You can see because the full arch is untouched and you got the short. So I made all the specimens. I made a ton, like 90 smart denture conversions, 90 traditional conversions. I went to an engineering lab on my school campus, and we broke them. Here's the pickup. See how pickup, this is like your full arch of multi-units. The right, this is your short tie base with your screw separable fastener. We just use general purpose acrylic resin powder and monomer. So this is a simulation, a lab simulation of Smart Denture. No holes, clean, fill it, put it over the tie bases, let it set, pop it out. Okay, picked up. Then you use the 3 holes and you have little holes, clean holes. This is the simulation of the old school, the traditional conversion technique. Long temporary cylinders, because they're long, they have to poke through your denture. So you got to make the big holes. See how the cylinders are poking through the denture? So you got to have those holes. And you pick it up. And then you got to backfill the holes and you got to trim it. And you can't do it into occlusion. And here's group 1. I use 3D printed Onyx. Group 2, this is conventional conversion, old school way. This is smart denture conversion, new school way, clean. Old school way, new school way, old school way, new school way, clean. And then this is just the Instron machine breaking it, printed conventional. Okay. And here's the results. 3D printed resin, conventional smart denture conversion, mean fracture rate 79 compared to 67. Injection PMMA, if you did a smart denture conversion, the mean fracture rate was 68.5. And if you did a conventional, 54. So smart denture stronger and stronger. In the milled, there was a little bit of a difference with strength, and that had to do with, some samples broke a little bit early on and things like that. But if you tally everything together, and we had a statistician do all the, math, he found out that after all my research and all my numbers, that the method of conversion, whether you're doing a smart denture or traditional conversion, the material of choice and the material and the method of conversion were all statistically significant in increasing fracture strength of the specimens. So basically, if you use smart denture conversion, the fracture strength is higher than if you use conventional conversion. And here's all the F ratios, the P values. You want the P value less than 0.05 to be statistically significant. Here's my results. I'm trying to publish this. It's in the works of being published. Here's all the tables of all the data. And basically, what was the one sample of the 180? Which one fractured the easiest? Well, it was an injection PMMA with traditional conversion. Which of the 180 samples took the most force to break? Smart denture conversion, 3D printed. And here are some examples of how it broke. Okay. So bottom line is, if you use, according to my study, if you use 3D printed resin denture with smart denture conversion, you get the strongest prosthesis, But really, you can use any material, but just use smart denture conversion, and it's going to be stronger, right? And that makes sense to everyone, right? If you have a denture that you're not even touching, and you making the small screw channels, you have another denture where you mutilated it and you drilled in big holes in it to accommodate the long cylinders. Of course, the one that you drilled the crap out of, by the time you use the repair pickup material, it's going to be weaker. Okay, here's all my references for the study, and here is Smart Denture Conversion and their starter kit. They have all kits available, make it very easy. They have education, they have training. I highly recommend that you buy a kit, go to training in person, do it on a model, things like that, because you have to try it first. You can't just buy a kit. Do not just buy a kit, bring it to an all-neck surgery, and then go do this. Do not do that. You should get a model and go to a training course. There's plenty. Watch videos, watch a lecture. Just call Smart Denture Conversion, call Lexier Dental Lab, and get a little educated before you do it. This way you have a good time. Once you do this a few times, 2, 3, 5 times, you're a master. Okay, I'm going to pass this over to Ryan, and I'm going to unshare my screen. That's all I have to say. And I'm gonna let Ryan take over from here. Any questions later, please ask. Please, we are very passionate about Smart Denture and helping everybody in this country and nationally have an easier life with these conversions.
Right. Thanks so
Thank
much,
you.
Dr. Bender.
Thanks,
Oh,
Dr.
go ahead,
Bender.
Melissa.
I just want to mention, someone had reached out and said, unfortunately, I'm sorry, the chat was disabled. So it's all set now, but you were able to enter anything in the Q&A. So apologies if there was any questions, but certainly please let us know if you have any additional questions. Q&A or chat will work.
Yeah.
Oh,
Any questions? Just if you couldn't type it in now. Type it in now.
yep. Go to it. All right. So thanks, Dr. Bender. That was great. I really appreciate everything that you've been doing with Smart Dentures, and I really like the study too. So my name is Ryan Napolitano. I'm the Director of Implant and Surgical Products for Lexier. And in addition to that, I've now also been tasked with launching a wide-scale digital denture program. So I'm going to be doing a lot more digital dentures with my Smart Denture Conversion kits. So I always like to start off this segment of the webinar talking about why I like Smart Denture Conversions. You've seen Dr. Bender's science behind it. You've seen the how behind it. And for me as a lab technician, it comes down to really why do I do this? You know, so many times I walk into surgeries with clients, and also my counterpart, Karen Gauthier, walks into a myriad of different systems, a plethora of different techniques, and it's up to us to provide the consistency and predictability that clinicians are looking for with this therapy. So over the years, I've developed a treatment philosophy about how I like to approach these cases. And it's very simplistic, but it certainly does keep me focused and it keeps my thought process really clear with what I'm looking for. And the first tenet is this: patient specific treatment. I don't like to chase new techniques, new fads, new technology for the sake of the new technique, the new technology. I want to have solutions that will benefit my patients, reduce clinical time, and add consistency to the restorations that I make. If a product can do that for me, I find it to be worthwhile. If it can't do that for me and it's just something that's cool, sure, I'll play around with it, but more likely than not, I'm not going to integrate it into my day-to-day routine. Second is be flexible. All of us who have done these full arch cases, and I'm assuming that the vast majority of the participants here tonight have been involved in a full arch case in some fashion. These cases don't often, well, I should say they don't always go to plan. And if there's a surgical complication, if something happens during the conversion process, or a myriad of other things, it's up to us to remember to be flexible with this treatment. We're trying to provide solutions for the patient, but when an obstacle presents itself, we need to know when to pivot, when to stay the course, and when to really, consult with the patient and say, hey, we're changing treatment because of X and Y. So on the lab side, one of the specific things that we try and do is solve for today's problem, but plan for tomorrow's surprise. And I've learned this lesson. I'm a second generation lab owner. I've learned this lesson because I'm now in the process of restoring a lot of the cases that my father had done 15, 20, 25 years ago. And what we're finding is that these cases were great cases when we did them 20 years ago. But the patient's health has changed, or the patient has, new complications, or what we're trying to rehabilitate now that we have 20 years worth of use is not functional anymore in the current climate, either due to parts that are no longer available materials that are difficult to replace, reline, or refabricate, a bunch of different options. So we're trying now to be much more modular with our designs, much more simplistic with our designs, so that when we make it today, whoever has to work on it with this patient 5, 10, 15, 20 years down the road knows what we did and has a good path forward. And the last one is just be honest and transparent about what we're doing. You know, many times I have come in the middle of situations where things were promised or a treatment was already decided upon. And I have to be honest and say, hey, you know, we've encountered these problems. We're not going to be able to do it this way, right? It's better to, what I like to tell people is, have reasons versus excuses. I like to be very upfront about things as opposed to hiding them until the last minute and then everything blows up. So that's just where I'm coming from as a lab technician. Now, we've seen some of the process already, and I really look at these cases in 3 components, right? We have our first component, which is the surgical component. That's not my area. I'm more than happy to walk in once the implants are already placed. You know, we're happy to consult on what we feel is best needed for an optimal result prosthetically, but we're not talking surgery tonight. So the next section is component selection. Now, as Dr. Bender alluded to, we're all kind of excited about an upcoming multi-unit abutment that we think is going to drastically simplify a lot of what we do at this level. But today, there is a lot of choices. There are OEM choices, there are third-party choices, there's multi-unit, there's straight. Some cases people wish to go direct to fixture. There's a lot that goes on here, and there's a thought process behind why it is that we're doing what we're doing. And lastly is the prosthetic attachment. That's the big one for us today. And we're going to talk about this more. But again, why I choose to use Smart Denture Conversions is very simple. I don't like to be confined to a specific ecosystem based on a product. I like to ensure that what I'm doing on a given case is best for that case. I want to have a lot of different tools in my toolbox that I can pick readily from and get a case completed. Some cases and bone types call for one type of implant, others call for a different. I get that. And that can influence what we're doing for abutment changes and everything that goes along with that. We also have guided surgery. We also have digital techniques. All of these options I run into in various clinical situations. And again, speaking to predictability and consistency, the one thing that ties all of these options together is how I'm converting my prosthetic. And for me, Smart Denture Conversions makes it simple, it makes it predictable, and we can just integrate this into so many different techniques to accomplish what we're doing. So I often tell people that when you're looking at different products in the marketplace, you have to remember that this ecosystem that's created is a corporate affair. Where, you know, there's a finite amount of dollars that are attached to a full arch case. Companies know this and understand this, and they are trying to see how many of those dollars along the way they can acquire per case. And that's why you see a lot of companies coming out with a wide range solution, something that's going to go from implant to final screw, something that is going to tie you surgically to a system and then give you an easy option prosthetically to follow the case through. Because they understand that if you play in this one sandbox, there's a certain amount of revenue that's there. And it's not a nefarious thing. It's a business practice. It happens to us all the time in dentistry, but you have to be cognizant of it. And you have to be able to say, hey, I like this component because this suits my patient needs well, but I want to be able to do something else with this down the road. And that's where the flexibility comes into play. So when we look at that prosthetic componentry, this is what I like to say is where all the chaos is. Are we driven by a surgical product? Do we have the flexibility to adapt to situations that are happening during the conversion process? It gets very confusing when we start to map out exactly what we're doing and with what components. And again, from my standpoint, I tend to be conservative and I want to have all my bases covered. So far tonight, you've seen denture conversions. And Dr. Bender has his case where he had his horseshoe denture, that he converted. If you were asking me what I would do if this was my mom sitting in the chair, I would tell you that I would be doing a denture conversion on her. Why? Because at the end of the day, at the end of this surgery, my mom is leaving with teeth one way or another. And if we find out that we don't have good initial stability in the bone, or prosthetically something, isn't exactly where we need it to be, I'm going to fall back on that denture. And guess what? The patient's leaving with teeth. They may not be leaving with teeth that are fixed and attached on day one. They will be in a week or so, but they're leaving with teeth. That's my promise to the patient. One way or another, you will leave with teeth. Now, if I had done it as a stackable guide and I had a PMMA temp, we've had problems with those cases. And there have been situations where I've had to add a flange and a pallet to a PMMA milled temporary, and it is not pretty. So from my standpoint, it takes me the same amount of time to get from A to Z. I want to have that predictability along the way. So that's where my mindset comes in. I'm always striving for that predictability, right? Technology has moved a long way, and I'm very thankful that it has. A lot of that technology trickles down into different facets of what we're doing. But at the end of the day, I need that predictability. So even if I'm doing a guided surgery case nowadays, if the doctor doesn't even request it, I still have a full denture in my back pocket because I don't want to have to deal with it. So we talked about this ad nauseum a little bit, and I want to just kind of go through it again. But we have here a smarter way to do this. And you saw this pickup process earlier. Here I'm doing this with light cure chairside pickup material from Zest. I happen to like the light cure process. Same thing as Dr. Bender described. I'm adjusting the denture as if I'm adjusting it for locator pickups. There's that denture coming out with 6 implants. You can see that it's about the same amount of pressure as if you had, really just put your locators in and you were pulling that off. And for me, it's as simple as these 4 steps. Obviously it's a little oversimplified, but for the purposes of what we're doing tonight, this is it. Create the pickup wells, seat the appliance into centric occlusion. Once it's picked up, we're trimming away excess acrylic and creating the access holes. When we talk about how we're doing these cases, it's really important to understand what the end result is going to be. Now, Dr. Bender had mentioned on his earlier case about AP spread and how on one of his cases, he was using a pterygoid implant to get as far back as he could. All of these considerations are things that we are thinking about during the initial treatment planning. And it's a very important step along the way. Dr. Bender probably starts all his cases the same way that I do. We have an initial scan or impression, and we're just looking, right? We want to see what the smile line looks like. On that maxillary case that he showed, there was probably a fairly decent and aggressive alveoplasty in that anterior segment. We want to know that going into it. If that patient has a high smile line and we don't take enough bone away, we're in for an aesthetic nightmare. And so this is the culmination of all the effort we've put in a month ago. And we want to get through this surgery as predictably and as quickly as possible. But just remember that everything that we're doing here, you can see on the left that we have an alveoplasty that was done on this ridge. Everything that was done here was planned out in order to get us the right aesthetic and functional result that we were looking for. So you can see this doctor was a BioHorizon trained doctor. You can see that we have our alveolus adjusted. We're lingual to the extraction sockets, and we have our primary closure. All right. Now, I said we weren't going to talk too much about surgical. We'll talk a little bit about surgical. When I do these cases, normally from a workflow standpoint, we like to see the implants placed. We're going to do our multi-unit selection here, right? And then we're going to do a primary closure. Not going to go all the way through and really button everything up at this point in time. Just enough to get all of the tissue closed roughly, because I want to do my pickup now. And then while I'm adjusting the denture, the doctor is finishing up suturing, doing some grafting along the way if necessary. We're working in parallel. We're not working one after the other. So it shortens up this treatment time for us. So you can see here that we're affixing our Smart Denture components. Rubber dam, I still like rubber dam. Can't get away from it yet. You know, I've had different products come my way, but at the end of the day, rubber dam still seems to work. And here we have this denture adjusted, ready to go for our pickup. One thing that I normally like to do is we're incorporating now using the conmeteor gauges to go off of VDO. If you haven't seen that gauge work, it's a really, really nice tool to use in your practice. Basically, what it does is it's going to take some anatomical measurements and it's going to give you an idealized VDO, or it's going to allow you to easily track your VDO during your procedure. And so here, when we adjust this denture and we seat it in the mouth, I'm going to take my gauge and I'm going to still make sure that if I had 38 millimeters before, I have 38 millimeters now and not 43. So it's an easy way for us to check along the way and just keep coming back at every step of the way to maintain that VDO that we all know is so critical with these cases. Now, once we've done the pickup on the lab side, the interesting thing with Smart Dentures is they're giving us lab analogs with the case. Hooray! So for us, this is a godsend. I'm going to take the lab analogs provided, and while I'm cutting the denture down, guess what I'm making? A master model that I can then articulate against an opposing, and I can do a silicone matrix on. So now, why is that important? Well, now I have stable VDO, I have a verified master cast, and I have a silicone matrix of what the temporary looks like too. I've already taken 2 appointments out of the restorative visit. Now we don't need to do bite rims. I really don't need to do a denture setup, and I don't have to do a verification jig either. That's all off the table and less headaches that you have to deal with restoratively. And then after that, same as Dr. Bender, we're going to go through and we're just going to adjust that denture. And he's right on the money. It took me 2 or 3 conversions on a model before I just got the feel of how that little final drill worked, and I could flick out the little bit of the peak screw that gets left in the denture. After that, it's a very methodical, repetitive process. It's very tactile. It's easy to do. There's really very little that you can have go wrong with these cases. And here we are seating our appliance. And again, same thing. If you look, my case too, the number 11 one, I'm right in the cingulum of number 11 with a thin lateral next to it. If I was making that big hole to adjust the denture, there's a good chance that I'm losing one of those teeth, or it's just going to be a shell. And when I reline it, I'm going to have one pinky looking tooth. That's not going to be great. So the Smart Denture system in that regard is a lifesaver. It really lets you push the envelope of your implant placement. I don't have to do 17 or 30 degree MUAs on everything and pull them way back to the lingual to avoid problems with the pickup. I can have these screws right in the cingulums of the lingual where you'd want your final restoration screw holes to be. We're getting more petite restorations. We're getting better patient acceptance in the temporary. and we're getting easier restorations to transition into the final. So it's always a nice thing. Now, with these restorations, I like to have just light pressure the day of surgery. That's going to swell a little bit, and then it's going to recede a little bit. Again, reasons versus excuses. We always talk to the patient and say it's very common after about 4 days for you to have a small space under your appliance. We expect that, and we need that for your temporary, so it's easily cleansable during the healing process. I don't have many complaints here. The occasional patient will ask us what we can do because there may be some whistling or something like that, maxillary only, but that's really all that we have. Now, I mentioned earlier about guided cases. So what happens if you want to do a fully guided case and you're into a system and a process? Well, guess what? At the end of your guided case, you still have a PMMA that you need to pick up and attach. And right now, I would guess that most systems that you're using are giving you a PMMA with holes in it and saying, hey, go ahead and pick these temporary cylinders up. And guess what? You're still ending up with big holes in your PMMA. I use Smart Denture Conversion components on mine, and I have them not drill through my PMMA temporary. And I'm getting the same results with a smaller screw hole, and it's just as predictable, and I am even increasing the speed that I'm getting with these guided surgery cases. So for me, guided surgery is all about speeding up surgical cases that are already predictable. I don't advocate using guided surgery to push the envelope of your skill. It's not that kind of a tool. You know, guided surgery is there to make you faster with what you're already achieving. It's not there to let you achieve things that are a reach. So if it's a really tricky surgery, if there's really funky anatomy, if there's very irregular bone, I will tell you that the best clinicians I work with usually opt to have those cases freehand because they trust their hands more than they trust the computer. And they want to be able to pivot on those cases when there's a problem. If you look at the case that we have here, there is a huge defect in this bone in a few areas. This is a case where, in my mind, I would have pivoted off of a few of those osteotomy sites and we would have moved things around. But we were working with a guide and we were stuck with those positions. And so I like guides when they're apropos. But at the end of the day, when we're connecting all of these cases, be it guided surgery, be it photogrammetry, be it a traditional freehand case, I can attach all of my temporary prosthetics with Smart Denture components, and I can do it predictably and efficiently every time. Normally, my conversion process, I know we're 3 minutes over, kind of rushing here. To give you an idea, normally my time from when the appliance is picked up until when it's polished and ready to be put back in the patient's mouth is around 45 minutes. We've had some cases where we've been in the high 30s, and not to say that we time each other in race, but we do. But as a general rule of thumb, 45 minutes from pickup to delivery is about where we're at. All right. So that's all we have for you tonight. I really appreciate you hanging out for a few extra minutes with us. And on here, we have a survey. We always like our surveys. And so any feedback is more than welcome. We really appreciate your time this evening. And if you could, please go ahead and scan that survey for Alyssa. She really likes the feedback.
Thank you, Ryan. Thank you, Dr. Bender. Yes, I do. The survey, just so if you can give us feedback on the course. Ryan, if you can maybe just pop that back up in case anyone wants to.
Sorry about that.
Don't take away my QR code now.
There you go.
Thank you. So, just to give us a sense of what you thought of the course, and then any other topics you'd like to see for education. We definitely value your feedback on the program. So I don't see anything currently in the Q&A or the chat, but we can definitely hang around for a couple more minutes if there are any additional questions. I think everything else got answered during the presentation. I would also just encourage you to check out our website. We have all of our clinical education courses posted on our website. So check that out. And then if you have any questions just regarding this course or CE, please feel free to reach out to me directly. And thank you so much, Ryan and Dr. Bender. That was excellent information. You know, certainly, oh, I think I see a question. Let's see. Thank you for the presentation. You're welcome. You guys both have a great perspective from the lab side and from the clinical side. So, and I think it's very important, you know, just lastly, I'll just say, working with a lab that can really help you with these cases. I mean, the Smart Denture Conversion System is awesome. We as a lab also offer training. So if you want to, you know, get to a point where you're really able to do these cases on your own without chairside support, that's part of what we offer. And the Smart Denture system really makes it possible for clinicians to be able to do this, you know, quicker and easier. So any last comments, Dr. Bender or Ryan?
Yeah. I never really mentioned any like timing. I love how Ryan talked about the time. If you're lucky with a conventional conversion, you're looking at the 2.5 hour range. If you're unlucky, and sometimes things are out of your hands, or just the traditional conversion technique is out of your hands. Sometimes it could take 3.5 to 4 hours, and I'm a little embarrassed to say it's happened to me a handful of times. A 4 hour conversion by the time you finish it and polish it and get it through all the things. When I use Smart Denture Conversion, you're looking at 1 hour max. You're looking at 1 hour max, and you're having fun while doing it, and you're confident while doing it. So I love that you mentioned that, Ryan, and I had to contribute my experience with that as well. It's just a no-brainer, and I really encourage everybody, please look into Smart Denture Conversion. It's going to change your life.
Yep, absolutely, absolutely. All right. Well, again, thank you all. I really appreciate you attending. This is great for me. It's great for us to get out and spread the good word here. So we hope you all have a great evening, and be sure to, as Alyssa said, check out the website. We do have a ton of education there. We also have upcoming webinars and events there as well too.
Awesome. Thanks, everyone. Have a great
Good
night.
night, everyone. Bye now.
Bye.